mynews.studio.
Imagine a heart beating inside a chest, kept going not by a surgeon's hands, but by robotic arms. Can technology actually perform this kind of life-saving surgery as well or better than a human could?
It's July 12th, 2025. Today we're looking at the first fully robotic heart transplant ever done in the United States. This isn't just a tweak to current procedures, it's a real shift. Let's start here. What sets this apart from previous heart transplants?
In traditional heart transplants, surgeons have to open the chest, break the sternum, and physically handle the heart. Even with partially robot-assisted surgeries, a human hand is still deeply involved. But in this case, the entire procedure relied on robotic systems. The surgeons controlled robotic arms, guiding instruments through small incisions, never actually touching the heart themselves.
So, with these robotic arms, is the main advantage just making smaller cuts, or is there something else going on here?
There's definitely more to it. The robotic arms allow for finer, more precise movements. Plus, the surgeons get 3D imaging and magnification that just isn't possible with the naked eye. Smaller incisions do mean less blood loss and a lower infection risk. But the big difference is that since the chest isn't opened up, recovery is faster.
How much faster? Did the patient actually leave the hospital sooner than usual?
Yes, and that's a key point. In this case, the patient was discharged after just a month, with no complications at all. That's a big deal. Most heart transplant patients stay hospitalized much longer and face tougher recoveries. Here, the patient got back to physical activity faster, with less pain and better breathing.
That sounds like a serious benefit for patients. But what about surgeons? How do they even learn to do this? Isn't it a completely different approach?
It is. Surgeons have to train on robotic systems, like the Da Vinci platform, for example. They need to learn remote instrument control, navigate 3D views, and operate multiple robotic arms at once. It really changes the skill set compared to traditional surgery.
If the robot is doing most of the work, does that mean more hospitals can offer heart transplants now? Or are there still big barriers?
There are still barriers, mostly financial. These robotic systems are costly, and training teams takes both time and money. Large hospitals in the U.S. might manage it, but smaller centers or those in lower income areas can't as easily. So until the technology is more affordable and training is more common, access will be limited.
So, better outcomes could mean more lives saved, but only if hospitals can actually get the machines and train their teams. Is there any sign that, over time, this could be more cost-effective?
Some believe so. If patients recover faster, face fewer complications, and leave the hospital sooner, those savings might balance out the upfront costs. But right now, the tech is still expensive, and scaling up training will take time.
Still, it's a substantial step forward. Heart disease is the top cause of death globally, and there's a constant shortage of donor hearts and skilled transplant surgeons. If robots can make this surgery safer and more precise, could it help patients in places that don't have enough experts?
That's the hope. If robotic transplants become standard, it could mean safer, more accessible surgeries, even in regions with fewer specialists. Plus, it could set a new precedent for complex surgeries in general, encouraging wider adoption of robotics in medicine.
It's a big advance, not just for heart surgery, but for medicine overall. What's next? Are other organ transplants likely to follow?
That's already being discussed. If robots can handle the heart's complexity, other organs are probably next. But it'll depend on time, cost, and figuring out the best ways to do these procedures.
So, in summary, we've seen a fully robotic heart transplant. Less risk, faster recovery, but still real challenges around cost and access. The potential, though, is significant, especially for global health.
And this is just the start. Thanks for joining us as we dug into the details.
Thanks for listening. This episode was brought to you by mynews.studio. Try it now for free.